Okay, well, good evening, everyone. Welcome to this hustings on the future of Scottish social care. Angus Robertson, Scottish National Party candidate for Edinburgh Central. Lorna Slater, party co-leader and one of the Scottish Green candidates for Edinburgh Northern and Leith constituency. And Susan Webber, candidate for Edinburgh Western and councillor for the Pentland Hills ward from the Conservative Party. Welcome to you all. My colleague Carmen, Vice Chair of the ETUC, will now start our meeting with an overview of the state of social care in Scotland, and then we'll hear from each of you with your opening statement or up to 5 minutes. Thank you.
Thank you, Claire. I'm having some problems with the connection, so I hope that I can go through the initial speech. Thank you very much for inviting me to speak today. I'm also a social care worker. For a decade now, the social care sector has been impacted by the implementation of austerity policies. The Fair Work Convention report on social care in 2019 highlighted the issues affecting the workforce. 83% of whom are women, and of them in low wages. The Philly report in 2021 have echoed the same very issues, making clear that very little had been done to improve the struggles of local authorities, workforce, and people receiving care and support. If anything, the Philly report had made clear that the situation in the sector had further deteriorated. COVID-19 had put social care into the spotlight. The appalling deaths and suffering of senior citizens in care homes, some of them with not even access to palliative care or family contact in the last days of their lives, has certainly been the highlight of how underfunded and mismanaged the sector is. Social care is an investment for a healthier, more equal and just society. It's not a burden. Edinburgh City Council does not provide care and support for people who are assessed as low or moderate criteria for support. Not investing in prevention and early intervention services is a short-sighted approach to social care, a false economy approach that does not benefit anybody, apart from people managing the budgets. By that, I mean implementing austerity. However, even people assessed with substantial or critical needs for support struggle to get appropriate care packages to meet their needs. The implementation of self-directed support has been disappointing, to say the least, with people trapped in a maze of referrals, matching units and assessments only accessing support in extremist situations. We are all clear about what is wrong with social care, but now we are all familiar with terms like race to the bottom, budget struggle, or postcode lottery. We need a cohesive, comprehensive, and clear way forward to solve the situation from politicians. The Philly report does not provide a clear route to go from the current situation to a national social care service. When we came out of the Second World War, we created the NHS. It was possible because there was a political will to do so. There was a common understanding that investing in health is not only the right thing to do, but also the clever thing to do. Back in the 50s, politicians had the support of the population, citizens that had put their lives at risk in the front line and at home. There was an acknowledgement that people deserve to be rewarded from their sacrifices and work efforts by creating a universal, publicly owned system to look after people's health. There are some parallels between post-war Scotland and post-pandemic or still pandemic Scotland. One of the differences now is that the only acknowledgement that social care workers received had been the clapping at windows, doorsteps and balconies, and the promise of a 500 bonus pay that we are yet not received. As a society, we are facing a number of challenges at local, national, and global level. Perhaps the other main challenge is climate change and just transition from fossil fuel-based economy to a green, sustainable economy. At a time when social care demand is increasing, and it is likely to keep this way, investing in social care could be an exceptional opportunity to put our grain of sand to facilitate just transition. Improving social care, creating a nationalized social care system is a matter of political will. It is what the citizens deserve, and the time is now. I hope that we don't let this opportunity pass. Thank you very much for listening to me.
Thank you, Carmen. Now let's hear from the candidates. In alphabetical order, we're starting with you, Sarah.
Okay, well, it's great to see everybody tonight, and thank you for letting me go first. I actually was at the hustings last night, where I was last because of my name, so I wasn't sure who was going to come first tonight. I'm really glad you've organised these hustings. Scottish Labour has called for the reform of social care and the establishment of a National Care Service since 2011. Our proposals were at that point rejected by the SNP government, and I think, picking up on the introductory comments, we now face the toxic legacy of what happened in our care homes, because a third of COVID deaths occurred in our care homes, and the Scottish Human Rights Commission has raised serious concerns about damaging cuts to home care services during the pandemic. So our care services face a massive challenge coming out of the pandemic. Staff are exhausted, and people they're looking after are vulnerable, they're socially isolated, their families are under huge pressure, and many of them are actually very angry about how their relatives were treated. And we deserve a public inquiry and answers about how the scandal of so many people's loved ones died and were affected by COVID ripping through our care homes. But I think I'd want to start off by saying that those failures were part of a systemic failure and a predictable failure. And I know the work that's been done by Nick Kempy in his submission to our Scottish Labour Review on social care and the National Care Service, and also his submission to the Feely Review, which is published by Commonweal. And he highlighted a key recommendation in the 2016 Cygnus report about having PPE available for all care homes. And that was something we called for time and again in the Scottish Parliament, where staff and residents were put at risk, with staff forced to wear inappropriate PPE. They didn't get access to testing for months. They had to fight for PPE. They were badly let down. And I spoke to staff who actually feared for their lives. So we were raising this issue throughout the Scottish Parliament over the last year from the get-go. And my colleague Neil Finlay, that many of you will know, his mum's in a care home. So he saw from the front line exactly what was happening from day one in March. But I think that the stories that we had from constituents and workers were heartbreaking, but the reason I'm glad you've chosen to do this topic for tonight is that we have a chance in the next Scottish Parliament to fix the systemic failures in our care services. So if we think about the Lothians, delayed discharge has been a long-standing problem in the Lothians, and we've raised it countless times with NHS Lothian, as people were stuck in hospital with no care package to let them leave. And before the pandemic, delayed discharge was out of control, with older people at risk of mobility loss, infection and loneliness. Not my words, the words of Age Scotland's Chief Exec, Brian Sloan. And in NHS Lothian, we saw 124,000 delayed discharges in the year before the pandemic, costing NHS Lothian £30 million. And it was more than 12% of the total overall bed days in our hospitals. And across Scotland, this has been an issue. But the tragedy of last year was that having a major issue with people not having care packages, suddenly at the drop of the hat, people were discharged. So that's why we need a public inquiry. And I noted the comments of our health secretary this week, but our chance now is to learn from the experiences, not just of what happened in the pandemic, but of the problems that were there before. And that's where I'm really keen to focus going forward. The NHS was spending a huge amount of money, keeping people in hospital who should have been able to go home. And because we've got an ageing population and we'd had 14 years of SNP cuts and underfunding to our local councils, our care services have been hit very badly. So there are some no-brainer things we need to do coming out of the pandemic. Investing in adaptations, it would be a no-brainer so that people's homes are accessible and they can return home and they can be looked after in their own homes. We carried out a policy review in 2019, which reported last year, and we looked at how to address the failures in care. We had some fantastic representations from trade unions, from relatives, and the third sector. I want to reinforce the points that were made in the introduction. Care workers are paid an average of £9.79 an hour. That's less than £18,000 a year. And as you've been told, the vast majority are staff who are women workers, many from Black and ethnic minorities too. And we have seen increasing profits being made, particularly by large care homes. The Fair Work Convention didn't just identify that 20% of the care workforce weren't on permanent contracts, but that 11% were in 0 hours contracts. Now that is totally unacceptable. We actually say, Scottish Labour, that we don't want any 0 hours contracts from any public sector funding, from any of the contracts that are set by our Scottish Government or by our councils. But 1 in 10 care staff said they wanted to leave the sector in the future, and that was before the pandemic. And that's why we've been campaigning relentlessly as Scottish Labour for decent pay for care workers. We moved amendments to the Coronavirus Act last year, which would have guaranteed care staff at least the living wage and would have strengthened their position by collective national bargaining. And in this year's budget debate, we argued that all care staff should be paid £15 an hour as a starting point. We owe it to those care workers who've worked tirelessly throughout the last year and the families who were let down to see real change. And Scottish Labour agrees with the Feely Commission recommendation that we have a national care service with proper resourcing as a national priority. And that's why addressing poverty pay has got to be an urgent priority, with decent terms and conditions throughout the care sector and wholesale reform of the care sector. We should have national negotiations on terms and conditions, and that would let our local authorities focus on the planning and the designing of the services that meet the needs of our constituents in every local area in Scotland. So for Scottish Labour, this has got to be a top priority as part of our national recovery plan from the pandemic. And it's part of our health recovery as well. We will argue for change, we'll work constructively with other parties in the next Scottish Parliament, but our top priority is making sure that the inequalities that have gone on far too long in the care service are addressed. And that would not just benefit the staff that work in our care sector, but it would benefit the people they care for and their families and our wider communities. And that would be transformational change. Thanks very much.
Okay, thanks very much, Sarah. Fred, you're up.
Thank you, Claire. So I'm Fred Macintosh. I'm the Liberal Democrat candidate for Edinburgh Southern. I'm also second place on our regional list, which frankly is where we have the greatest prospect of gaining. I want to obviously start off with the basic pitch we have, which we need to put recovery first. We need to focus on what needs to be done now to recover from this pandemic. We all went through the last 5 years of Brexit. Every moment was Brexit, Brexit, Brexit. We saw what putting borders up, what nationalism can do. We saw this sort of frankly horrific statements from Mr. Farage and his friends about foreigners and how we need to stop the Europeans feeling so superior. And now we see the same thing from people in Scotland wanting to put up borders across the UK. And what we want to do is to build on what powers we have to solve the problems we have in front of us. And I think to address social care, the Liberal Democrats, we don't support a national care service, but we do support a number of steps that I think will be essential to ensure that as we rebuild in a positive way. Because a lot of I agree almost entirely with Sarah's list of the problems, but I don't agree with the solution. Because I think if we look at the NHS in Scotland for a moment as a comparison, the NHS in Scotland has been harmed in the last decade or so by over-centralisation. And if we look at, for example, NHS Lothian, do we really want to give an organisation as wonderfully capable and organised and responsible and good at planning as NHS Lothian responsibility for any more of the social care system? So we think there should be national pay bargaining. We think there should be national fair work standards. After all, the state is paying for it, so it can impose the standards. There should be career development on a national basis, and there should be local commissioning. But we don't think there should be a national service. And I think the thing that made me realise the key point is something Sarah said a moment ago. She wanted to see local authorities doing planning. Well, I have no confidence that if we had a national care service, local authorities would have any involvement at all, because I think it would be like the National Police Service, in that everything will be decided centrally, pushed down from above. Now, maybe that wouldn't be too much of a problem in Edinburgh because we're a big city and we have quite a lot of clout in the country. But I think if you look at rural areas, there's a real fear that a nationally specified service would be inappropriate for rural peripheral areas of Scotland, and they might want to do things their own way. We also have the problem of the VAT issue. So when the SNP centralised Police Scotland and got rid of Lothian Borders Police, which I personally thought was quite a responsive organisation, everyone warned the Scottish, and that's SNP, who had a majority then, of course, that this organisation wouldn't be entitled to an exemption from VAT. They said, no, it's not a problem. And of course, it wasn't. And it took the best part of 5 years to resolve that because local authorities had the exemption, but national bodies didn't. So the same thing might well apply here. And it seems to be, frankly, a gross waste of money to centralise and possibly go through the same loss of skill, loss of local knowledge that we've all probably come across when we deal with the police in Scotland. So we'd like to see an improved, dramatically improved and radically changed social care system where local commissioning, local authorities and local communities have a much higher role in specifying services, and also where those who use the services, both directly and in some cases families, have an input into what sort of services are available and control over budgets. And we suspect that, maybe it's a little paranoid, we suspect that a national care service delivered by the SNP or the Labour Party might not be an entirely decentralised organisation, might be a little monolithic, and wouldn't respond to local problems. And so for that reason, we don't support that part of the scheme, but we do support a radical change in standards. And particularly, we have to move to a situation of parity of esteem between NHS staff and social care staff. Now, there's a lot of questions in the chat about the role of the private sector. I think there is a good point to be made about the way that some large companies have taken profit out of the social care system. The same, of course, is often true in the NHS as well. And what we need is a system which imposes standards, fair work standards particularly, on those companies. So it's much harder for them to take profits off the employees effectively and off the backs of their employees. And if that forces some of them to leave the sector, well, maybe we then create local organisations to take it on. And that seems to be a model in much of Scandinavia. And the idea is that we deliver the services that are appropriate for our communities. Edinburgh will have a different need from Clackmannanshire and so on around the country. And so that's our position. Now, I will happily talk about health and other issues for the rest of the session if asked about it. But I would just add this. We have a lot to, we've been through a really difficult year. We all have discussed it. There's no point trying to illustrate it by examples. We all have. There's so much that needs to be done. This is the opportunity to solve problems. If we elect to the Parliament people interested in putting up another border, that's what they'll talk about for the next 5 years. Now, some of them will talk about it in an unpleasant manner and some of them will be terribly civilised, but they will still talk about it. And so we want to put recovery first, encourage you to vote Liberal Democrat in the elections when they come round. Thank you very much.
Okay, thank you very much, Fred. Angus, it's your turn.
Well, first off, I have to unmute myself and apologise to everybody on the call if you hear a 22-month-old baby resisting going to bed in the background. There's no walk-on part planned, but you never know what might happen. Thank you very much for the invitation to attend. As somebody who has been around the block in politics for a while, during my 16 years as a member of the Westminster Parliament, it was the invitation from my local trades council that was the first to arrive and which I always attended as somebody who has myself been throughout my working life as a journalist, a trade unionist member of the NUJ. So I understand the value of trade unions, have been a long-standing member of a trade union, and should I have the good fortune to be elected on the 6th of May, I'd be delighted to come back and work with you all, a commitment I'm sure everybody else on the hustings would be prepared to give as well. A little bit about myself. My name is Angus Robertson. I am standing in Edinburgh Central, the most marginal seat in the capital city. Only 610 votes between the SNP and the Conservatives that currently hold the seat. All of you on this call, regardless which constituency you're in, will be working out how to cast your vote. There is no constituency in Edinburgh where your vote will count for more than in Edinburgh Central. And if you'd rather not see a Tory MP representing the heart of our capital city, it's going to take a vote for the SNP to replace Ruth Davidson's successor as a candidate. So on to the subject matter for this evening. We've been asked to come along and talk primarily about social care, and I'm reluctant to rehearse the points that have been made by colleagues, some of which I agree with, some of which I don't. But obviously, the issue that we're dealing with is reform of adult social care, but also the backdrop of the pandemic. I should declare an interest in this, in that I have an elderly father for whom I have power of attorney over, and have been dealing with all of the issues that have been raised so far on this evening's hustings. And to those who are on the call, who work in the sector, you have my undying admiration for the work that you do. It's not always easy. The service that has been provided has been first class, from hospitals to care homes, which is where my father is at the present time. Also, a little note on this, of course, is grateful for the assistance of everybody who works in the social care sector, but in addition to the very high percentage of staff there who are women, is also the very high percentage of staff who come from other countries, primarily the rest of Europe. And I very much hope that all of them, those of you who are on the call, realise how much your work here in Scotland is appreciated, how much we deprecate being taken out of the European Union against our will and your citizenship rights being denied, that you've had to apply to remain in the country that you were invited to come to in the first place. And hopefully that can be rectified. Unlike the Liberal Democrats, who seem unable to do two things at the same time, I'm very keen that not only can we get on with things like social care, but we actually have a form of governance in this country which is fit for the 21st century. And what happens in normal countries is you make all the major decisions yourself. So I look forward to the Scottish Parliament having a majority that's in favour of you, all of you, regardless of where you come, the people who live in this country, to be able to make a decision about where we're going, because there's been a material change in circumstances since the last Scottish Parliament election in relation to Brexit. We've been taken out against our will. We should have a choice as to whether we want to rejoin the European Union as a sovereign member state. I'll be able to argue in favour of that and on important issues like adult social care at the same time, even if parties like the Liberal Democrats will find that difficult. To the heart of the matter before us on the review of adult social care. Obviously, the backdrop to this is that an independent review has been held into this, that a great many recommendations have been made. I think I'm right in saying 53 detailed recommendations from the report in February 2021. And these should be influencing all of the parties' manifestos. Now, I'm at a slight disadvantage. I know the Scottish Green Party has already launched its manifesto. The SNP manifesto is about to be launched. So forgive me if I'm unable to give you any sneak peeks as to what is in the manifesto, but no doubt you'll be following the publication of that manifesto closely, given that the SNP is the only party running in this election to be elected to form a government. So I very much look forward to the manifesto reflecting the recommendations that were accepted by the SNP in government in the outgoing term. And that includes important points like the creation of a national care service, establishing a human rights approach to social care that incorporates equality, individual autonomy and citizenship, better support for and representation of unpaired carers, the introduction of a national improvement programme, shifting from markets and competition to collaboration and commissioning and procurement practices, delivering fair work for the workplace, and increased and more effective investment. The report that was published not that long ago highlighted the need to move from old thinking to new thinking about adult social care, and also highlighted the need for a more collaborative approach to adult social care for a step change in capability to address the implementation gap, for the voice of the lived experience to be amplified in all aspects of the proposed redesign. So I'm very confident that the next Parliament is going to see fundamental change to how social care is provided in this country. I don't oppose the considerations that we have to make sure that in a national care service that the care is provided in a way that reflects the need and desire of people in different parts of the country. But again, it cannot be beyond the wit of men and women in this country who created a national health service to also create a national care service. We're living in the 21st century rather than the 20th or the 19th century. We should be able to manage the creation of such a national care service. I think that it will provide a step change that all those who rely on its essential services are provided with. You will have the choice as to whether you want that introduced in the next Scottish Parliament. I'm working very hard that we can have an SNP government returned on the 6th of May so that we can get on with it. That would be my opening starter for 10. I look forward to your queries and questions and reiterate the point that I made at the start. I very much look forward to a productive and ongoing relationship with trade unionists in Edinburgh, regardless of the election result. Thank you very much for inviting me.
Thanks very much for your comments, Angus. Next we go to Lorna, please.
Hello. Thank you very much for inviting me. I'm Lorna Slater. I'm co-leader of the Scottish Green Party. I live at the top of Leith Walk in Leith, and I am an electromechanical engineer. I work for a company that builds tidal turbines. We're currently building the world's largest tidal turbine in Dundee, and it's going to launch next week to get towed up to Orkney. So it's a very busy time on all fronts. I'm also a trustee for the Edinburgh Remakery on Leith Walk, which is part of a vibrant network of social businesses that we have in Leith. In this election, I am a constituency candidate in Edinburgh Northern and Leith, and I'm second on the Lothian list after Alison Johnson, who's been an MSP in Lothian since 2011. Alison is one of our most accomplished MSPs and has many significant pieces of legislation to her name, including the Young Carers Allowance and legislation eliminating unnecessary dehumanizing disability payment assessments, requiring those assessments to be recorded and allowing people more choice as to where the assessments take place when they have to happen. Alison spoke out starting from last April for regular testing for care workers to help keep them safe at work. And this policy has eventually been implemented by the Scottish Government. So care workers are absolutely top on our minds. I wanted to pick up on a few things that have been said already, because some of them I think are really interesting. In Carmen's opening statement, she pointed out that social care is related to the climate crisis, that we cannot tackle the climate crisis without tackling inequality. And that means making sure not only that all workers are properly paid, but that everybody is able to participate equally in society and get the care that they need. And we couldn't agree more. Absolutely. The environment and climate is not a separate thing that needs to be kept in a separate box. It is something that should be integrated and considered in everything that we do. And we absolutely consider that tackling issues like care and inequality is part of the big picture of reshaping society that must happen in order to tackle the climate crisis. So I was delighted to hear Carmen say that. I think we can all see that the patchy provision of care in this country, which is a mix of public care and a private profit-making care and third sector care, has been a massive issue during the pandemic, where we, because of this patchy provision, we haven't been able to roll out best practice or collect data in a way that really would have helped us tackle the pandemic and support carers much more. We are, and I can say confidently because we launched our manifesto today, we are committed to building a national care service based on human rights. Our care system is in crisis and requires a radical overhaul. The Scottish Greens will work with others in the Scottish Parliament to build a publicly owned national care service and deliver immediate reforms to better reward and support carers. And I did get the impression at the debate the other week that Willie Rennie did support a national care service. So I'm a little confused by Fred's assertion that he doesn't. So I don't know which one of them has that wrong or whether I just misunderstood the debate, because I think it's something that we should absolutely work together on. I'm excited that there's cross-party consensus on this. It makes it so much easier to move forward together. And I think it's a real strength of the Scottish Parliament that because of our proportional system, it encourages consensus building and negotiation, and all of us to work together. So some of the practical things that we'd like to implement around the National Care Service are ending competitive tendering as a first step in building a care system which is centered on people, not price. We believe that there is no place for profit in our care system, and we'll look in the long term to remove the private sector from the provision of care. I think that arguments against nationalization, because nationalization might equal centralization, isn't what fundamentally a national care service is about. I mean, imagine such arguments being brought to stop us from starting an NHS. It's absurd. So of course it's possible to have a national organization with standards of pay and standards of care and common data collection and common sharing of knowledge and experience, and also have it implemented locally with locally reactive bodies and local knowledge too. It's completely possible to do this, and that's absolutely, in fact, how it should be done. The Scottish Greens are big fans of decentralization and of empowering people to say what's right for them and to say what's right for their communities. We would absolutely protect local decision making and accountability in line with our principle of subsidiarity. We want to ensure that pay and condition of carers reflect their expertise. We support calls for social care workers to be paid at least £15 an hour, and that is something we would like to work towards. Recognizing the value of unpaid carers and ensuring they have access to the training, equipment, and respite breaks that they desperately need. We want to introduce health checks and access to flexible healthcare appointments for unpaid carers. So there's a whole bunch of stuff in our manifesto. Hopefully you'll ask me lots of good questions about it as we go forward, but I can see that there's 3 things that the Scottish Greens feel strongly about and have implemented in our manifesto, which really will transform social care in this country. First of all, is that we really want proper funding for local councils. This is a serious area of frustration for us, that local councils in Scotland do not have the powers to raise revenue. We haven't had a reform of the council tax that we've been promised. We've got to sort this out and make sure local councils are properly funded. We need this national care service. We're completely committed to that. And we need living wages for carers. And I think those 3 things together would reform care in this country. And we look forward on working on those things in the Scottish Parliament.
Thank you, Lorna. And finally, Sue.
Yes, last but not least, thanks very much. Yes, thanks very much for asking me to participate tonight in this hustings as well. I'm actually really more interested in hearing from the members that have all zoomed in, and I want to be able to demonstrate my commitment as a Scottish Conservative to supporting the much needed transformation that's, as we've said, needed in our social care. And I'll not reiterate much of the specifics that were mentioned by Sarah specifically as well, because we are facing a crisis in Scotland in our care, caused in part by our ageing population, but made worse when combined with historic underfunding under the SNP government. And I was quite surprised there with Lorna's comments regarding local authority fair funding, when it's the Greens that have approved and supported the SNP budgets more recently, that's particularly seen Edinburgh being so underfunded, and we're crying out for fair funding. But we have to remember that social care is intrinsically linked to healthcare, and it is only if we are not in full health do we need or rely on some element of social care. And we need to recognise the many thousands of people that work within our health and social care sector, and they have made an invaluable contribution and continue to do so to so many lives, whether they be residential, domiciliary, paid or unpaid. And of course, let's not forget that carers must receive the right support to help them carry out their caring roles too. It's physical, it's demanding mentally and physically, and they need support and respite. And carers have played a really vital role in our fight against coronavirus. And I'm so grateful for the hard work that they have had in what was very difficult times, particularly on the onset, when they didn't have the PPE that was so necessary and so essential. And looking back, it's quite alarming with what we put these people through. And I'm committed to ensuring that there are positive changes for care workers and that these are all implemented quickly. The Conservatives have long been a champion for carers in the Scottish Parliament, and in 2016 we passed an amendment to the Carers Bill which required local authorities to provide short breaks and ensure that a person's care plan is agreed as soon as possible before they leave hospital. And that all contributes to that delayed discharge element that Sarah was talking about. But it's important that we have those conversations with the carers as well as the person at the centre of the plan. So we want to work with councils and families and providers to take forward reforms that will embed choice and put social care on that sustainable footing as we go forward. The other thing that makes me really be delighted to be here today is that I've got a unique insight and a lived experience that no other panel members on here have. But I'm pretty sure that if that's incorrect, I'll be held to task very shortly. But let me explain. For 25 years, I've worked within the healthcare environment, albeit as a supplier. It does give me an insight into the culture, the decision-making, the changing and shifting priorities, and most importantly, where blockages happen, where things break down and progress is halted. And I have met healthcare professionals from porters to professors, all of whom I have listened to and have respected and helped where possible. And in the last 4 years, I've also been a board member on the Edinburgh Alcohol and Drug Partnership. So I understand the very real challenges faced on the front line when it comes to delivery of services. And last night, of course, we heard how the First Minister stated clearly that she'd taken her eye off the ball when it comes to our catastrophic drug death crisis. And I've also, as a councillor, for 2 years, I was on the Edinburgh Integration Joint Board. So those members sitting on here that are in that social care element will know the role that the IJB plays. And I have had to work with the health and social care professionals, the members of staff from NHS Lothian, to help create and deliver the directions that ultimately cascade down to that plan that you have had to work with. And that with an environment of increasing central government control and reducing budgets. I've heard from the various third sector reps, the union reps and the patient advocates of the real issues that are faced on that front line. But then you hear also about the challenges of delayed discharge, the loopholes and the maze that people have to go through to get that care package, to get out of hospital and to stay at home, which is where they want to be. And I tell you what, I have got many, many, many cases that come to me when the families are on their knees and they cannot navigate around and there's just one too many hurdles and they cannot get the care that's needed for their family member. And I feel for every single one of them. And that is where the crisis lies. So we've already said that the subject we've got tonight is vast and diverse. And I know that the conversation may go in so many different directions, but I'm very much looking forward to all of your questions and what will very much be a lively debate. So thanks very much.
Thank you, Sue, and everyone for your opening statements. So we'll go to the questions now that are in the chat. So if you want to have a little look at them, feel free. But I would introduce Bruce, first of all, Bruce Whitehead, who's going to ask his question first. Thank you, Bruce.
Hello, thank you. Hi, everyone. I hope you're all well. The SNP recently reacted to the Feely report by saying that they would continue to have a private sector involvement in any national care service. Last year, unfortunately, sadly, my mum died in a care home just at the beginning of the lockdown. The care home is owned by HC1. HC1 is owned by a very complex offshore network of companies. And despite being very profitable and the largest, I think, care home company in the UK, making roughly £25 million profit per annum on several years running, only £2 million was paid in tax because most of the profits were paid in interest payments to private equity finance groups that underpin these companies. But there was still 42 million dividends for investors left after that. Angus Robertson, the question would go to you first, but to the other parties too. Why do you have to have a private sector role in our care service?
Okay, Angus, would you like to come back? Then we'll go Lorna, Sarah, Susan, then Fred.
Well, I'm going to make a very short response to that because I want to be absolutely unambiguous about my my desire to have the minimal of private sector involvement in our National Health Service, and now obviously we're turning our gaze on the National Care Service that we're looking at introducing. And I think you're absolutely right to raise the issue of any companies that are profiteering, firstly. So there's absolutely no role for that. And secondly, I think what is required in these circumstances is transparency. You know, obviously, you've looked at this case of the care home provider that your mother, and my condolences to you on her loss. You've been able to get some distance in understanding how this organization is set up. But I think we need a lot more transparency, and we need these organizations to be held to account. So I think the issue is well made about concern of organizations that may be profiteering about providing public services, especially in this area. This is something that we've, I think, are quite right to be concerned about. We've seen recent reports on literally billions and billions of pounds that has gone towards often very opaque private sector suppliers of PPE and other equipment in relation to the pandemic. The one common factor amongst many of them is that they seem to be run by people who are repeat donors to the Conservative Party. We have to end the granting of contracts to companies that are opaque, where the common factor is that they're donors to political parties. All of that needs to change. So I think the questions that have been raised are good. I don't think there's a simple answer to any of them, but I think a mixture out of a commitment to maximum public sector provision, firstly, secondly, demanding maximum transparency of who people are, in which way they are acting, and if there are absolutely any examples of profiteering or inappropriate political connections through lobbying or any other way, that is something we need to get to the bottom of.
Thank you. Lorna, next, please.
Thank you very much for your question, Bruce. I mean, you've managed to define exactly why public services shouldn't be handed to profit-making businesses. I don't believe that choice is an effective mechanism for improving services for everyone. It improves services only for those rich enough and powerful enough to actually have the choices. It does not improve services across the board for everyone. It's an artificial means of attempting improvement, and it simply doesn't work. I mean, imagine the business that you described, Bruce. Imagine if those profits, imagine how good it would be for our economy and for our quality of care if those profits hadn't been taken offshore, but instead reinvested in the care service or even into general taxation in Scotland. It's absolutely horrendous that services that we need are being exploited for profit. There are certain things that humans need: food, housing, medicine, education, social care, and all of those things we should work together to provide for one another. I'm very happy for there to be markets and competitions in other areas where people really do have choice, but we don't have choice about the things we need to live, and they should not be exploited for offshore companies. So yeah, I think that there's absolutely no role for profit-making businesses in care.
Thank you, Lorna. On to Sarah, please.
Thanks, Bruce. And I hadn't realised about your personal circumstances. That must have been pretty horrific to go through. I think the key thing here is that we make sure that we have different standards. Now, it's not just national negotiation for pay and terms and conditions. It's things like proper support for care staff. So, for example, care staff earn very low salaries, as several of us have said already, but they have to pay pretty substantial costs to be professionally registered every year. So that's something that I think needs to be looked at. That's the kind of thing that could be dealt with if we've got a national care service that's met by the state. So that's the first thing. The second thing is the Care Inspectorate does not have enough powers. And that came very clear during the pandemic when HC1 and Skye, for example, the same care company you've talked about earlier, the experience of that care home in Skye, where the state actually had to step in. But what I've been told, and I've been to quite a few meetings about this, and I've read Nick Kempy's work on this, there is really something about how some of those companies extract money from the system, and they're very clever at it. And it's not just about not paying tax in the UK, it's about flipping properties. So that's why I think having national standards, I'm not going down the route to reassure Fred Macintosh that it is entirely controlled from the Scottish Government's minister. That's not how we see a national care service. National standards, local delivery, and the standards issue is absolutely crucial because that does need to be empowered through the experience of the pandemic. And finally, the other thing I would say is that I used to work in local authorities, and you can see the fact that local authorities have pulled back from providing care. Fundamentally, they have not got enough money to provide the services they need. So I'd like to see more integration on the ground. So Lumfinnins is a great example of a care home built as part of a wider set of affordable housing. It's integrated, it's quality, so that the people who live in the care home are not isolated in the care home. They're part of a wider community. They're not excluded from activities. They're near stuff where young people are involved, so young people are brought into the care home. It's a very different model. And I think having the pressure put into this next Scottish Parliament about salaries, about transparency, about national standards, and about empowering our care inspectorate, that begins to tackle the issue of those outlying companies who have just basically been earning a fortune, and they've not been looking after the residents, and they have certainly not done a decent job of the staff that they have had, who have been completely let down by the system. And that's what needs to change urgently. Thanks.
Thanks, Sarah. On to you, Sue.
Thanks, Claire. I mean, yes, Bruce, that's very tragic circumstances that your father and your family have had to suffer at the beginning of this. But the but is not all private care homes operate to that standard. Okay, there are others that are doing everything right and are addressing and providing excellent standards of care. Okay, and we have to be mindful of that. We can't tar everyone with that same brush, and we have to give an element of choice within health and social care. I'd like to pick up though on something that Angus said around opaque PPE suppliers. I am a PPE supplier and certainly was, continue to be a PPE supplier, and not one NHS contract was given to me, a Conservative candidate, just to make it clear. But I did have, when there was no PPE in any of the hospitals, people were crying out for it. The only person that phoned me and screamed and shouted and effed and blinded down the phone to me looking for PPE was the owner of a large number of private care homes, okay? They were shouting and championing their staff. So we can't tar everyone with the same brush. And that's the one thing I want to say. And we have to recognise that there are responsible care homes in the private sector that are interested in providing excellent service to the families and the people under their care. All right, so that's my bit today. Thank you.
Thanks, Sue. And Fred?
Yeah, I mean, the ownership of large care home groups has been a scandal for a decade or more. And if I remember correctly, HC1 comes out of Southern Cross and the collapse of that group in 2011. And it's not an area of my professional knowledge, but I do remember reading that all the landlords in these groups wanted to keep their businesses trading. They had residents in the care homes. The company that had been renting it had gone bust because it had too much borrowing from venture capital. So they went back to another venture capital company, and so on and so forth. And you get this spiral down of standard reduction and a complete ignoring of people in the care homes. Now, it's very nice to hear Angus say what he said. But Southern Cross collapsed in 2011. So every single HC1 care home in Scotland presumably has had a contract from local authority integrated joint boards to provide some services if it does take funded places. And that's something that could have been changed. It's perfectly possible to apply that. And so what Sarah's saying about the standards and the skeleton of a national standard could have been brought in at any point in the last 5 years. It wasn't. We hear constantly in this election the announcement by the SNP they're going to do something wonderful, normally to correct the thing they did badly 4 years before. But ultimately, there is a role for choice. Now, I'm slightly perturbed by the fact the Scottish Green Party has just announced they're in favour of the nationalisation of the food supply system, because that clearly will work wonderfully. But choice is important for one reason, and that's because a lot of people, not everybody, fund their care of elderly relatives directly, because there isn't a large national system. There's never been the debate across the whole UK about the funding of social care of the elderly for those who aren't means tested to receive a smaller amount. Now, that debate hasn't happened. It's probably responsible every party that it hasn't happened. But we therefore are in a position where some care homes will be providing spaces to people who are paying themselves. And in that role, we're probably going to have some form of choice of some degree, but it has to happen within regulated standards. And I think there's a valid point to be made that large groups that are taking profits offshore shouldn't be receiving contracts from local authorities or the National Care Service. That's what we ought to do with procurement. The Tories should have done it with procurement over this pandemic. The SNP should have done it with ferries. Whenever you spend public money, you should apply standards. And I would be uncomfortable at seeing the end of all privately run care homes, but equally the large ones where it doesn't seem to be running care homes is the thing, it's making money out of property is the thing, definitely need to be squeezed out of the market if that is possible, and it probably is, by intelligent procurement rules and high quality national standards. Thank you.
Thanks, Craig. You've all had a chance to answer that first question. Is there anybody that wants to come in again just to answer or highlight any points? Nope. Oh, Ian, would you like to come in now?
Thanks, Claire. Yeah, I'm from Unison. I support a fully nationalised health and social care service. And I was interested in what Sue was saying earlier, because the one thing that I do remember during this pandemic was watching the owner of a care home being interviewed on a news article. I think it was on Scottish News. And basically, I can only describe it as having a basic moan about not being able to procure PPE for his staff. And to be quite honest with you, here was this gentleman sitting out the front of a huge mansion with a Land Rover behind him and another what looked like a Bentley. And here he was pleading for money for the government to actually fund getting PPE food for the staff that were caring for clients that were paying for his very expensive house and cars. So I don't see any reason for the private sector at all in the care sector. The other thing that I wanted to raise, and it's more a private thing than anything, a few of the speakers tonight have mentioned care plans. 2 years last March, my mother got out of the Western General on condition that my sister moved back in where she was terminally ill, and the 12 weeks that she was back home before she died, she did not receive a care plan. After 3 weeks, my sister actually had to call health and social care in because we hadn't received any nursing assistance. And when she did eventually pass away, the service which comes to pick up the equipment that was delivered to her house came in dribs and drabs. Instead of just having one van collect a bed and other items, they sent three vans, 3 drivers, and numerous things happened. I think there is far too much bureaucracy in health and social care with the senior, far too many managers. I think we need to get back to basics. Health and social care staff need to get decent resources, decent pay, and be recognised for the professionals that they are, regardless of whether they're OTs or care home workers or home care workers. They deserve the title of being professionals. And we've got a lot of members in Edinburgh who are health and social care staff who have done, along with all other frontline staff who have done a fantastic job all the way through this. Thanks, Claire.
Thanks, Ian. Des, do you want to come in and then we'll ask the candidates to respond to both of you?
Yeah, I mean, I'm not only Secretary of Edinburgh TUC, but I'm Secretary of Unite branch, which has 1,300 members and organises social care workers, including domiciliary care and care in homes. And I've been to lots of care homes representing people, so I know very well what it's like. And I've been negotiating with EIJB officials as well over the years and had lots of discussions about the future of social care. What I want to say on behalf of my members is that our members are very sceptical about what the Scottish Government is actually up to and what its promises mean. I mean, people have complained to me about the Raw Sick Kids scandal. How did it ever happen? How did it actually, the Scottish Government and the public pay money to the private sector to deal with complaints that they had caused? It's absolutely amazing that that has happened, and it's continuing to happen too. The other thing I want to mention is that the role of social care, number of social care homes in Edinburgh increased from 20% to 80%. That was a decision taken by the Council and the Scottish Governments. And EIJB officials have said to me that was a catastrophic mistake to do that, and it should never have happened. And they said it should be reversed. But this is my question really, this is a big issue. Social care needs to expand, there needs to be more homes, to be more places. Who is going to provide it? I say the public, Scottish Government and local authorities have to provide the extra beds and the extra homes, and the Scottish Government and Scottish Parliament should cough up the money.
Thanks very much, Des. Any of the candidates want to...
You want me? I was going to go first because my name was mentioned, I think, in some bit of the verse. So I'm quite happy to go.
Fred and Sarah.
Sorry, I've gone a bit crackly my online there. Sorry about that. I suppose not everyone wants to go into a care home, Des. Okay, and I really, really think that having good quality care at home is what more and more people want. Okay, but that provides a whole different set of circumstances and challenges. Where we heard there about the challenges we have about getting that assessment done. That assessment in hospital, you go into hospital if you've fallen or tripped or ill, a doctor or whomever your clinician is always going to assess you as being worse than you were before you had your incident that brought you into the hospital. So you will need support to get out, okay? But that assessment hasn't been happening fast enough. And that then when they've done the assessment, determining the care package that you need and getting the resource so that you can go home, so you're not relying on your daughter or whomever to be with you, is there. That's the bit that causes the delay. And then subsequent to that is that reassessment. If your requirements change, because some people will rehabilitate when they get home and recover, so their care needs to taper off. But that reassessment's not taking place either, which again frees up resource. But it is a complete and utter red tape nightmare. And it's only when you have a few really good people, and it's finding these really good people in the roles that can make things happen on the ground. And the frustrations and the workload we had, it was at one point over 1,400 assessments outstanding in the Southwest at one point, and I'm sure if Scott Arthur's still on, he will confirm or deny that number, because I can't quite remember, I was looking for the report. But it's the sheer volume of people that we have, and we need to be able to work with them. And I don't think everyone going into a care home is the answer, because I know so many people would far rather be at home for as long as possible. So we need to figure out a way to get good care at home.
Okay, thank you, Sue. Fred, will you come in now, please?
Yeah, I mean, Ian, I think your story is unfortunately a very frequently heard one. And I have a particular interest in palliative care, and like many of the candidates, we all receive emails from people urging us to support Marie Curie's 3 campaign pledges in this area. And what I thought was really striking is I read the middle one, which was a commitment asking the government to commit that everyone who needs palliative care should receive it before their death. And I thought I've seen that before. And indeed, in December 2015, that was a commitment made by the Scottish Government Cabinet Secretary for Health and Social Care, which hasn't been implemented. Remains outstanding. And this integration of this transition from hospital to to the community is a huge problem. Now, I'm old enough to have been a councillor from 1999 to 2007. Clearly, my boyish good looks confuse everyone, but I was the chair of the area committee of South Edinburgh for 4 years before I stood down off the council. And we had a really good system of integrated local provision. And one of the things was that small numbers of GP practices worked together in very tight groups. There are about 16 in the city, and delivered the integration between hospital and community primary care and social care. And there were small teams led by, in some cases, social workers, in some cases, NHS managers, in some cases, nurses. It was cross-disciplinary. And what it meant was it was being run out of GP practices, not because they were in charge, because they were convenient local buildings. And if you go down to Cameron Toll, the Conan Doyle Medical Centre was built for that purpose. And that inability to run things tightly and locally with local knowledge seems to have gone. And we have this monolithic system, because Sarah and I were both involved in politics before 2007, when the Liberal Democrat Labour coalition almost got rid of bed blocking. And it did it by really local management, by quite a lot of resourcing. And Scottish councils, Edinburgh Council has been filleted by the last 5 years of SNP and Green budgets in this country. And there isn't the money. And that's why these ridiculous and deeply painful things happen, that people have to endure the ignominy of not one helpful pair of people removing all the kit, but 3 people coming on different days and messing you around, and just what you don't need at that moment. And so we really need to look at it locally. And that's one of the reasons I'm a skeptic about a national system, not because I don't absolutely hear the point that you're all making, but because I don't believe in big bureaucracies. Every time we seem to have them, they seem to fail. I think small works best. I think a little bit of market helps too. A little bit of choice keeps the public sector honest, not too much, and not with Southern Cross. But I think if we have a system that empowers local teams, not necessarily democratically accountable, local teams to make decisions rather than have a big national solution, which is the SNP's solution to everything, then I think we begin to get these problems away, and we begin to introduce some humanity to what is an awful time for everybody involved in this process. So thank you very much for telling us about that.
Okay, Fred, thank you. And Sarah, please. I'll bring you in next, Angus.
Thanks. If I can come in and start off on the points that Des was making at the end there, and I kind of want to develop the point that was being made by Fred there about bureaucracy. If you go back, the reason I focused on at the start of my conversation about delayed discharge was because that was a problem that had got worse. Now in NHS Lothian, £30.8 million on delayed discharge. That money should have been spent on preventative care. It should have been spent on care packages to get people out of hospital, to get them looked after, to use the kind of preventative principles that Campbell Christie talked about in his fantastic report that was done. We're just about to celebrate a decade on that. Now, the thing about that is that our NHS is brilliant at the crisis. It'll be harder coming out the pandemic, but they focus on sorting a crisis. The bit that doesn't work is the care side. And that's why you need the national approach in terms of the funding, you need national contracts, but you need local commissioning, because we actually need the services delivered locally. And the service we need in Edinburgh is going to be different from the service in East Lothian in terms of the staff and the carers and the types of issues. And we need to fix this. And it's got to be a priority because we are an ageing population. And it's not just that we're an ageing population, but the inequalities have got worse in our country. And people who come from lower income backgrounds need preventative care urgently, because without that, they get ill, they die, or they go into hospital. So there's something that is, it's about how we have structured this. It does not work. So that's why I want to seize the opportunity of the fact that we've got this discussion in a national care service. The Feely report's not been implemented. It's a chance for us to dive in the next Parliament and make sure we get the right decisions. Because if you take the comments that were made about the IGB and the health and social care partnerships, they're not transparent enough. We've seen cuts in the last year, and it's because the councils aren't funded. So go back to that 30.8 million. If that money had gone into social care in Edinburgh and the Lothians, you'd begin to transform it. So a lot of this is about funding. When I came back to the Scottish Parliament, because I lost my seat 2016, I came back in 2019. And one of the first things I did was I asked, when's the next NHS Lothian briefing? And I was told, oh, they don't do that anymore. And I went, what do you mean? We've had that since day one. In the olden days, it used to be really difficult because the opposition used to give us a really hard time. And we used to take the difficult stuff right back to the ministers and demand change. So we've got NHS Lothian briefings again, and they've been very good at briefing us during the pandemic. But we need to make sure there's a tie-in between what happens in NHS Lothian, what happens in the IGB, and what happens in the council, because that's where people are let down. So we need to get that right. And the points that Ian made, that the fact that we've got particularly women who are now unpaid carers because there isn't care available locally is not acceptable. And it's one of the inequalities that's deepened in the pandemic, where women have lost their jobs or given up their jobs to look after a relative. That is not acceptable. We need to have a care system on the ground in our local communities. And that's why you need the national leadership, but you need the local delivery has to be funded. And that's the bit we're missing at the moment. Thanks.
Thank you, Sarah. And Angus, did you want to come in now?
Sorry, it was Sarah Boyack who was doing this last night, and it's me. I've taken on from you, Sarah. I thought I was unmuted. Apologies, everybody. Yeah, I think by and large, I think we should be pleased about the fact that there seems to be significant agreement amongst at least a number of us about the both the scale of the challenge in getting the right solution in this area, but the willingness to be imaginative and think big to try and reform the provision of services to the standard that we wish to see it going forward. We are a few weeks away from an election, which I think will return a majority that is in favour of a national care service, and I think that's a good thing. Some of us are able to say more about it this moment than others. I'm sure by the time you go to cast your vote, there will be much more information in the public realm about the proposals that all of our parties are making on that. But we really we need to have a shift in thinking that will underpin future funding, commissioning, regulation, and critically delivery. Sarah made a very, very important point, I think, and this isn't a Scottish point, a UK point, a European point. This is a point in industrialized societies, is that we are living longer, we're having more complex health and care needs, and we need to make sure that we have a system that's appropriate for this 21st century and not for the last century. And that's why I think legislating for a national care service with reformed integration joint boards, focusing on prevention, on early intervention, on deinstitutionalization, and at the heart, the involvement of people who use the service, the unpaid carers, the workforce, I think is key, as well as IGBs ensuring local representation will be vital in the shaping of this service. So I think we all should be aiming to work towards parity with the National Health Service, in which healthcare and social care are both free at the point of delivery, and work with local partners as quickly as is practicable to end all charges for non-residential care. So I think we should reflect on the fact that there is, I think, a growing consensus. There's a couple of colleagues who don't seem to be part of that consensus yet. Hopefully they will see the sense in this proposal. I think its time has come. We need to prepare to think big and try and build a national service with national standards that is worthy of all of ours. And we've heard a number of cases of people who've, especially parents, have gone through and sometimes had experiences which, you know, nobody should be waiting for healthcare packages and, you know, going through the bureaucratic example that's been given after somebody's tragic death. So no doubt there will be things that will happen in the future, even with a reformed service that isn't perfect, but I think it is not beyond the wit of man and woman. And there are examples in Other parts of the world, I often look to Scandinavian nations, tend to be a bit faster around the block than we are, to make sure that we have an appropriate service going forward. And of course, the pay and conditions of people who work in that service is a fundamental building block. So it's not just about the institutional architecture of how we do it, nor of the standards that we would wish it to uphold. We have to make sure that the people in that service are valued and are working in conditions that are worthy of the service that they give all of us.
Okay, thanks very much for your comments there. And we're going to move on to the next.
I haven't come in on that one yet. Yeah, I haven't answered that question yet. So, Ian, thank you for sharing your story and your views. The story you tell is a horrendous one, and I can see why it's been so upsetting. It's a good example of how the existing care system is not joined up, that it's this patchy mix of third sector, private sector, and public sector. And you're quite right. It wasn't just the big care homes looking for handouts, during the COVID pandemic. It's always the sort of Richard Branson was one of the first up the queue asking for public money to bail him out as well. It seems like the very richest are always the first to ask for handouts. I think a key part of the National Care Service is to relieve pressure on the NHS. We all know that bed blocking has been a massive issue around that, and that's I think that's a key part to not only helping the NHS recover from the pandemic, but to making sure that it's sustainable going forward. I have to especially thank Sarah Boyack for her excellent answer to this question, because I agreed with everything she said. I thought that was an excellent answer. And I'm very excited that, as Angus says, we have at least 3 parties in the Scottish Parliament who have a similar vision here for what we want to see with a national care service, and how we think that should work with the local provision, but national standards and national sharing of expertise. So that's exciting. This is the kind of positive transformational politics that I feel excited about at the moment. Whenever I go to hustings and in the debate the other week and in launching our manifesto today, it's such a change from the kind of negativity and sniping that we hear so much of, to hear politicians going, look, we've got a vision, we know what's wrong, we have an idea of how we can work together to make this better. We're listening to members of trade unions, we're listening to carers, we're hearing what you want, and we're going, right, we're going to do our best to implement something really different, really transformational. So that's very exciting. Bruce, I thought oh, sorry, wrong question. Des, I hear Des, I hear your frustrations there. Yeah, I agree. We definitely need people to have the right kind of social care in the right kind of environment. And a big part of that is pushing for the right amount of funding. Certainly, something we can work together on is pushing the Scottish Government to devolve powers of revenue raising to local councils, and to make good on their promise to properly refund the council tax, which was in their manifesto and that they didn't do. So I don't think we can let care be a postcode lottery. We can't let it be done at such a local level that we don't have national standards. So as Sarah said, and in her excellent answer, national service with locally delivered. I was, really good.
Thank you, Lorna. I'm sorry, I didn't see that you had indicated that you wanted to come back on that question, so I do apologise. Okay, we'll move on to question number 2 now. Thank you. I want to bring in Kathy Jenkins from Scottish Hazards. She has a question on health and safety for us.
Hi. As Claire says, I'm from Scottish Hazards. I'm also the branch health and safety officer for the Unite not-for-profit branch in Edinburgh. I'll take the advantage of speaking to say that I agree about the national standards, local delivery. I want to say that human rights is great, but human rights is not worth anything if you can't claim them. And I think we have to keep remembering that, because we keep talking about human rights, but they're useless if you can't actually make them real. And the other thing I wanted to say just briefly was that I understand that the Scottish Government has said that children's services should be not-for-profit. So I don't quite understand why adult services shouldn't have the same proviso made. But to get onto my question, apologies for usurping that, my opportunity to speak. We are very concerned in Scottish Hazards and the trade union movement about the fact that we think enforcement, health and safety enforcement, has been incredibly poor during the pandemic. And we also feel, and I would agree with Sarah on this and other people, that the Care Inspectorate is not powerful enough and has not been able to keep the standards, or keep up standards in care homes. So enforcement, I think, is a big issue. We are calling the background to this is that the Health and Safety Executive, which is the primary health and safety enforcer in the UK, has been cut by 50% over the last, well, since under the Conservatives' rule. And I have to say, it was also cut previous to that under Labour, but it has been particularly badly hit. So the Health and Safety Executive has lost an enormous amount of resource. It's also had its powers reduced, so that before the pandemic, at least, it was only allowed to proactively inspect a small number of sectors. And that the local authority environmental health, which is the other enforcer, they have also had almost equivalent cuts, as far as I know, across the UK. So we are calling for, Scottish Hazards and the STUC are calling for the regulation and enforcement of health and safety to be devolved to Scotland. We know that wouldn't be a panacea, but we think Scotland could do better. And I would really like to hear the candidates' thoughts about that, because we think it became so clear during the pandemic. I mean, it was clear to us before, but it's become so clear that we need stronger regulation and enforcement on health and safety. And although the Care Inspectorate is not about health and safety, I would include the Care Inspectorate in terms of we need stronger enforcement in the care sector as well. And I would prefer to see the Care Inspectorate having the job of inspecting standards rather than having to deal with the private sector stuff. I don't know why the Care Inspectorate should have to do that. I think it's got a big enough job in looking at standards of care. Thank you.
Okay, Cathy, this time candidates, we're going to go Sarah, Sue, Lorna, Fred, then Angus.
Right, thanks very much for that question, Cathy. Your point about rights is really interesting. It's a very similar to a point I made in the discussion we had in the Parliament just before we rose for the election about environmental rights. And I came out for Scottish Labour to support statutory environmental rights, but said the challenge with that is not everybody's able to exercise their rights, because only the powerful get to exercise their rights. And in a way that brings up the importance of having active trade unionists and people like Ian on the ground doing health and safety work, nagging away whether it's the council or a private sector company, and actually calling it like it is. So part of this has to be the trade unions being involved in these processes and being able to speak without fear for their members and for the people they represent. There's also something about inequalities and low-income communities in particular. So if you think about air quality, it's low-income communities that are hit by poor air quality, and it's staff. I mean, one of the things I got most angry about I'll just go back to care briefly. I was contacted by somebody who wasn't in a trade union, whose doctor had said, no, you shouldn't go into work. She worked in a care home, and her care home staff said, her manager said, no, don't worry about it. If you want to take time out, you'll get a couple of weeks statutory sick pay. Now, this young woman pays an Edinburgh rent. There's no way she could afford to do sick pay. So we went back and demanded a meeting. We got it fixed. And she's now a trade union member. So there's something about the collective strength that comes from trade unions. In terms of your issues about HSE, that's where I say I feel like an amateur in this issue, because I'm not an expert about HSE. I've done my homework on the Care Inspectorate, but it does seem to me that might be the kind of issue where in the next Scottish Parliament we need to have joined up the dots. And regardless of whether you change the legislative framework or accountability, there is nothing to stop us as a Parliament engaging in that issue and asking about what is the crossover between those two organisations, where does it work, and use the opportunity that we've got in terms of the debate we're clearly going to have on the Feely report to say, here's a practical example in terms of what happened in our care homes, this needs to be fixed. But if you go through other other employment areas, you will also find problems with health and safety. And that's something that is out there. So I think part of this is trade union rights, part of it is activism and membership, and part of it is working with us so that we can call people to account, we can do press articles, and we can get change. And I'll finish on this point. Scottish Labour has said we'd like a devolution commission. We want to look at where powers lie. And it's 21 years on with the Scottish Parliament. A lot of it has worked, not everything has. We have had some things devolved, but there's also something about respect, where you have UK organisations that should respect the Scottish Parliament and UK ministers that should respect the Scottish Parliament. Regardless of the politics, I'm going to really go for the Tories every opportunity I get, but there is something about institutional centralisation that you can see in governments at the UK level and at the Scottish level, and I'd like to devolve more power, but that doesn't mean that you don't need to hold people to account in those highest offices as well. Thanks.
Hey, Sarah, thank you. Sue, would you like to come back now?
Yeah, I mean, again, like Sarah, I'm not an expert on HSC. I have friends that are far more qualified. This might have been a question that we should perhaps have had a bit of insight ahead of the game, so we could come with party positions on that. I mean, it is, but all I would say is that wherever your healthcare intervention is taking place, it needs to be of the highest quality and the safest, and put no harm to either patients or staff or those giving the care. I'll not make any comment on bringing things under devolution, because our current Scottish Government, led by the SNP, has had many powers that they've not quite managed to take advantage of to bring about the very much needed change that we've need in our country already. It's been left rather wanting. They've had every opportunity to make us better than, but they seem to have just brought us down on everything from education, healthcare, and yes, my list can go on. I think I've got quite a few drug deaths, etc. But Kathy, if you want to drop me an email where they'll give me share our contact details, I will get back to you afterwards on that bit on health and social care, not health and social care, health and safety executive. So if maybe Claire can share that, that would be super.
Yep, no
Thank
problem.
you.
Thanks, Sue. Okay, on to Lorna, please.
Kathy, I'm very pleased to say that we worked with STUC when we developed our manifesto, and I can commit to in our manifesto that we believe that everyone has the right to a safe workplace, and that the pandemic has shone a spotlight as to how far behind we are in realizing this. The Scottish Greens believe that health and safety should be fully devolved for as long as we are part of the UK, allowing us to build a proactive health and safety system that is appropriately enforced. We support the creation of a national occupational health body within NHS Scotland that delivers a preventative agenda, supports workers and employers and unions to address issues and ensure that workplaces are safe. I mean, I just want to point out as well that it's a frustration with us that these issues were not devolved at our last opportunity to do so, which was during the Smith Commission, when Labour blocked the devolution of powers over Labour issues and things like the health and safety. So that was a disappointment to us. But of course, if we're going to revisit the matter, either through independence or through another devolution commission, we would be in favour of devolving those powers.
Thank you, Lorna. On to Fred, please.
Yeah, so my part of my background, well, a large part of my background is as I'm a human rights lawyer, and I think trying to enforce real rights, whether environmental rights or rights to a safe workplace, which I think everyone agrees in. It's not just the Green Party that agrees in the rights to a safe workplace. The idea that that requires the ability to enforce it. And one route is, of course, through collective bargaining, and Sarah has very carefully and correctly explained an advantage there. But the other is through the ability to litigate and to pursue answers. Now, I am a legal aid lawyer, that's what I do, so I declare an interest at this point. But the Scottish Government, they're not as terrible at legal aid as people down south. I accept that. And that does include the Liberal Democrats in coalition. We were pretty awful back then. But the legal aid system is important. We need to have access to lawyers to represent people against the state. And particularly in one distressing area, which is in fatal accident inquiries. There is a case at the moment which involves a young girl who died 4 years ago in the Queen Elizabeth Hospital in Glasgow. We still haven't had an FAI. FAIs are hideously delayed. Now, I absolutely get that they are the extremists of the problems of health and safety. They couldn't ever be anything else. But in an environment where Crown Office seems so horrifically under-resourced, because the alternative is they don't care, which I think isn't true, we have this effectively a failure to find out what's going on. I do wonder, for example, I should expect there should be a series of FAIs arising out, fatal accident inquiries arising out of the care home deaths. But I wonder whether there will be. And if they will be, whether they will happen in this term of the Parliament, because on current odds, they'll probably happen in about 10 years' time. And unless we're prepared to have the state open itself up to hard questions, we'll never solve these problems, even through collective bargaining. And the Scottish Government has been in power for a long time. The Crown Office is not functioning properly. The hugely stressed staff, FAIs are delayed. The legal aid system is in very bad state. Now, actually, the Smith Commission is the right answer for this particular issue. The Smith Commission recommended that we devolve the operations of the Health and Safety Executive in Scotland. But as I understand it, it wasn't actually the fault of the Labour Party. It happened in December 2015. Very little that happened in government in December 2015 was the fault of the Labour Party, or indeed the Liberal Democrats. The background, if I remember it correctly, was that the Ministry of Defence didn't want to have health and safety, devolve health and safety wandering around its bases. And perhaps given what the Scottish Green Party has been saying about that the last few days, maybe that was a reasonable fear. But the point is, that shouldn't have been the right answer. We should have had operational devolution of health and safety. It wasn't done by the Tories. They rejected it. They implemented most of Smith, which was good, but they didn't implement that. But I think the Scottish Parliament can do what it can with its powers. We can't make the Tories down south devolve health and safety that quickly, but we can hugely improve the way that we investigate deaths and serious crime in this country. And when I chaired the area committee in the council, we had an issue to do with health and safety in HMOs. The council couldn't address the problem. It couldn't get anyone to prosecute it. And I remember holding a meeting between the district procurator fiscal and the council officer who was saying, no one answers my calls. And we brought them together and we solved that problem. And a few people then found themselves in a difficult position. And ultimately, if we're going to enforce rights, we have to enforce them in the bad cases, because we just talked about big companies and big money. They're risk-averse organizations. If they know that the state's going to come after them when terrible things happen, I think they behave better all the way down the tree. At least I like to think that. It's basically what I do. So I'd like to see a real improvement in the turnarounds on FAIs. And I hope Angus will be announcing such a commitment, because that's the normal way that the SNP resolve these problems. They announce they're going to resolve the problem they caused beforehand. So I'm looking forward to what he thinks of my facetious answer to the question.
Thank you. Remember to unmute, Angus. Your turn.
And this time I've managed to remember to press unmute. First off, I think it's a good thing that in Scotland we are incorporating more human rights legislation. I'm in favour of human rights. I think they're a good thing. And I think the fact that we recently saw the Scottish Parliament unilaterally incorporate United Nations conventions in relation to children, I think was a good example of that. If our states can agree them at a multilateral level, I just don't understand why we shouldn't incorporate them into our domestic legislation, point one. Point two, Fred as a practitioner has raised important points about the gap between ambition or aspiration and the reality in different cases. And I think it's entirely fair to highlight where there is a gap between those two things. But that's where I'm a believer in both the pull and the push effect of incorporating human rights into our legislation. It is by doing that that we can empower different people in different circumstances to make sure that the law is upheld. FAIs and the MOD is a bit of a specialist subject of mine, having represented the most defence-dependent constituency in Scotland for 16 years. And I can attest to the fact that the Crown Office has run away from FAI responsibility in relation to the MOD, going way back to the Chinook case that we know from the West Coast, having represented families of airmen who lost their lives flying fast jets on our behalf, where no FAI was forthcoming. And it is a very good stroke bad example of the gap between the provision of human rights and learning the lessons in relation to health and safety, which is as relevant if you're in the military or in any other walk of life. Everybody should be guaranteed the highest possible standards of health and safety. And I know I am digressing massively from the subject, but when Sarah was making the excellent point about the role that trade unions have to play, incidentally, is an excellent reason why our armed forces should also see their personnel represented on a professional basis, so that we can see that their health and safety at work issues are dealt with properly. It manages to work perfectly well in countries like Denmark. I've seen it, it works. We should be doing it here. So firstly, to reiterate the point on human rights, I think it's a thoroughly good thing. I acknowledge the fact that there's a pull and a push factor. There may be a drag effect where it takes time to raise standards. But then more specifically, but not wanting to monopolize the microphone for too long, but I can give you a very short answer to this. Am I and my party in favour of the Scottish Parliament being able to deal with this matter? And the answer is yes. Incidentally, it is on everything else as well. And to hear the answer that, well, I don't really think that this is likely to go forward because of how the UK government may or may not deal with it. I mean, just making my point. Why do we wait for things to be sanctioned by people that we have not voted for since 1955 is beyond me. Let us raise the bar. We won't get everything right. We will make mistakes, but they will be our mistakes. And if we have a parliament that's close enough to the people, and if we need to improve it, let's improve it. But let's have a parliament as close to the people as possible so we can raise the bar. Let us not lay all of our hopes on an Andaluvian institution at Westminster, half of which isn't even elected by anybody, to make rules about important issues like this. Let us decide this in our country and just get on with it.
Okay, thank you very much for that, Angus. Ian, you've had your hand up for a long time. Would you like to come in with your comment now?
It was actually just on health and safety issues as well, but I was interested in what Fred said, because my professional job is an enforcement officer with HMOs, and the biggest problem that we've got is actually getting the Procurator Fiscal to take cases to court against landlords. But that wasn't what I was going to say. I was at a hustings meeting yesterday, and I was actually calling for an independent HSE. We've had issues over the last year during the pandemic and in the last 12 months, where I've had to call on them on 3 occasions. We've actually had to bring them into the council on 1 occasion because we were asking for all the updated risk assessments and safe working procedures for all the departments from April onwards, because I'm the health and safety officer for Unison, and we wanted to make sure that we were COVID compliant. The one department that we thought would have got it right got it drastically wrong, and that was health and social care. They had no risk assessments, no safe working practices, and through the subgroups that we subsequently set up, which I'm on, we found out they had no lone working procedures either. So we had predominantly women staff members going into people's homes, sometimes not even knowing that they had COVID symptoms, and we didn't have the proper risk assessments in place, and nobody's been held accountable for that. When I called in the HSE, I spent half a day actually talking to them and then having to submit a form, and then it took a week of constant phone calls before I actually got a call back to tell me who the inspector was. That inspector came in, charged the council for every telephone call and email that she sent, but never contacted me once. I ended up having to phone and say we had reached agreement that we would go in and do the risk assessments, get the staff updated, and make them fully engaged and fully informed about what we were doing. I've had to call on the HSE on 2 other occasions now, and the advice I've got to say is poor, and that's why I'm calling for an HSE that's independent completely of the government, properly resourced and properly funded. The other thing about Edinburgh Council, we have had under half our number of staff in the corporate health and safety team for almost 2 years now, because it was poorly managed before. The senior manager that we we have now is a consultant. He'll be leaving shortly. We've previously had 11 or 12 advisors. We've only got 6 or 7 at the moment, and a few of them have only recently been engaged. We also have an environmental health team, which is absolutely stretched to the limit, and yet we're asking staff to do more and more. And we've now got a situation where I'm not only looking at the setting up asymptomatic testing centres, but I've also got to think about what we're going to do health and safety wise for the 140 voting stations that we're going to have for the Scottish Parliament elections, because our corporate health and safety team and environmental health team will not be going all around these buildings. They just do not have the resources. With the HSE, one other point, the Westminster government funded £14 million to them last year, and the first thing that the HSE did was they gave £7 million of that to 2 bailiff companies to go in and start doing spot checks and works, and they are happening in schools and in our workplaces in Edinburgh. And that is so that the HSE can turn around at the end of the month and tell the Westminster government that they have done so many checks. The checks are substandard. They're a tick box exercise. We don't know how many inspections these people are doing in a day. We had, for instance, Edinburgh Road Services at Bankhead and Sight Hill. That was checked out the same week that Burton's Biscuits had 45 cases. And our depots directly across the road. Finally, sorry Claire, finally, I have to say a big thank you to Sarah, because if it hadn't been for Sarah, when we approached her about the BAME situations and the increased rate risk to the BAME community for COVID, Sarah took that to the Communities Committee in the Scottish Parliament, and the Scottish Government actually had a working group set up because of that. Previous to that, we had no information in Scotland about the risk to the BAME community. So a big thanks to Sarah for that.
Okay, thanks for that, Ian. Now it's the last 15 minutes of our meeting, so may I ask the candidates to try and keep their answers really brief for this last one. Remember, this is your final, probably a final statement that your audience will hear from you tonight. And I'm going to ask Carmen to ask the next question. It's a question that was put in the chat earlier, so you may well have seen it. Carmen, would you like to come in?
Yeah, I will read one of the questions from one of the people attending today. She says, we are meant to have had the integration of health and social care for some time now, but social care has long been the Cinderella sister to the NHS. And we saw this throughout the pandemic, where there was simply not sufficient understanding of the needs of social care and its workers. For example, PPE distribution, testing and vaccination. My question is, how can we ensure parity of treatment for health and social care staff without social care being subsumed by the NHS monolith? Also, and just to put these 2 questions together, also, Unite is campaigning for a £15 hour pay for social care workers, and would like to hear your view on these 2 things. Thank you.
Okay, thank you, Carmen. This time we're going to go Lorna, Fred, Sue, Angus, then Sarah. Thank you.
Thank you, Carmen. That allows me to sum up really nicely, because those are both points that I've covered elsewhere. But absolutely, we're committed to a national care service, and as discussed in this hustings, that is to be sort of nationally provisioned and standardized, but then delivered at a local and appropriate level. So, I mean, the NHS, you know, it can be seen as a monolith, but it is also something that we can be really proud of. And the fact that we still have a fully public NHS in Scotland, I think we've seen the benefits of that in how well Scotland has dealt with the pandemic as compared to down in England, where it's partially privatized NHS. So let's protect our fully public NHS and work to build a fully public national care service as well. And I think, as well as balancing health and care and making sure that care and health are given the same consideration, I think we could all agree that we need to make sure that mental health is on that on that balancing act as well, so that mental health and physical health are all part of the equation. And it feels to me like we're at a point where we're looking at something transformational, where we're looking at a completely different approach to how we look at human well-being. And that is not only how we manage our economy, but how we manage all these issues around health and care and mental health. So that's really good. I've already said that we are happy, we are committed to supporting calls for social care workers to be paid at least £15 an hour, and that is absolutely something we'd like to work towards.
Thank you, Lorna. Fred, next, please.
I don't know the answer to the question about £15 an hour. I understand that it's something where the party headquarters staff and the policy team have having been meetings with the GMB amongst others. So I'm sure an answer will emerge in due course, possibly in the manifesto. But I think to answer your other question, now it may be I'm a cynic. It may be that I don't share Lorna's optimism for the future. But I look at NHS Lothian and the monolithic service you describe and the flaws that exist there. And that's what I fear is what happens if we allow the same people to run a national care service. Because I think we need to empower local communities, local people, care service users and staff to deliver this sort of public service, whether it's education with teachers or for care workers in the social care sector. And we look at the record of this government, because the SNP have been in government 14 years, and we look at polls which suggest they're doing awfully well. And we ask ourselves, what's the next 5 years going to be like? Is it going to be the optimistic, happy world that Lorna is describing? Or is the City of Edinburgh Council, for example, going to suffer the same cuts that the SNP and the Greens have delivered for the last 5 years? And is the SNP going to deliver a centralised service, just like Police Scotland, with no local accountability and as opaque as NHS Lothian? I fear the latter. I would like to see a community-led service with community planning. Remember that? That was abolished by the SNP. I'd like to see that idea that individual communities would thrive. That was a driving force behind the coalition that ran the Scottish Parliament for the first 2 terms. I'd like to see that back. I'd like to see an optimism that doesn't involve nationalising everything and creating a single Scottish service. And that's why I'm running, because I look around and I see nationalists everywhere. I oppose Brexit with an enthusiasm. I am deeply disappointed to have had part of my identity ripped away. I don't want to have the next part ripped away as well. And I look at the people who've just emerged on the yes side in this new political party and their blood and soil nationalism, and it frightens me just as much as it frightened me when Nigel Farage stood in front of that picture of immigrants. But let's be optimistic. Let's try and decentralise. Let's use the powers of our parliament, this great, powerful parliament, to put recovery first. And let's focus on what we can achieve.
Thank you. And Sue, please.
Thank you. Yes, I suppose over the last 14 years, the SNP had continually raided council budgets to fund a variety of their pet projects, running down all our vital services. And social care is the one that we are here to talk about tonight. And that's the one that's, when you're at that point and you are the most vulnerable, when you are really needing help, it's not being funded properly. With all the carers, all the great intentions that our carers have, if they are not properly resourced, whether that be in terms of their mental health and their well-being and their reimbursement for the hard work that they do, that's what's going wrong in this system, okay? NHS Lothian is a big, big health board, okay? It's the third biggest health board in the country after Greater Glasgow, Clyde and Lanarkshire. It's unwielding. It cannot make the decisions that your mum needs or your dad needs quickly enough if it's needing care. Care and what your family needs at the point of need should be determined at the localist level possible. And that's very poor grammar, but you all know what I mean. It's those that are closest to you know best, okay? So we cannot have a centralised care system. And we think it's through fair funding of the councils and allowing the funding to get to where it's needed by getting rid of red tape, getting rid of through all those hula hoops you've got to jump around and move around through to get the care to you, they need to go. And I think that's what's key. Because remember that, as I said at the beginning, the SNP have had 14 years to deliver on the promises. And yet we're yet to see anything substantially change. And they could have done all of that. we've got an integration system that is absolutely mind-boggling in terms of governance, and no one can get their way through it, which is why they're having to look to change it again. But we're presented with the same promises that they're going to do something. So why should we believe them this time? And you know what? We're okay, because the Green Party seems to be much more interested in supporting independence than they are about the environment. And they need to recast where their positions are. And, you know, what are we actually interested in? Delivery of anything other than independence? No, we need to focus on recovery and putting our country on a real sound footing and getting the money into the sectors like our social care, which, as we've heard tonight, is so desperately in need of reform. Thank you.
Okay,
Claire.
thank you, Sue. And Angus, please.
Well, can I start off by saying it's an excellent reminder why I think the people of Scotland won't be voting for the Conservatives or the Liberal Democrats to form the next government at Holyrood, and thank goodness for that. There are at least 3 parties on this panel that are committed to delivering a national care service. This is being considered by the greatest experts in the land. At least 3 of our parties recognise that this is a move that needs to happen. Hearing echoes from Fred of the arguments that we would have heard in the mid-1940s against the creation of a national health service are not appropriate for the scale of the challenge that we require for our care service in the 21st century. We need big thinking, and absolutely there's a role for making sure that we are seeing the best and most responsive local decision making that is required in different parts of the country where there are different pressures on the system. But to whinge and moan about things never happening when we're on the cusp of a monumental step change in how we provide care services in this country is just so wide of the mark. I think that goes a long way of explaining why in this forthcoming Scottish Parliament election, the question is really whether we want the SNP to continue governing in Scotland or not. And I suspect that the people are going to say that they do. And part of the reason for that is that we trust the people of this country to make decisions about the future of this country. And that's why I think this is actually one of the most important elections, if not the most important election since devolution in 1999. We've seen a material change in the circumstances in the way that we are governed. There is no status quo anymore in Scottish politics because the old United Kingdom that was in the European Union is gone. We are now part of a Brexit Britain run by Boris Johnson's Tory party that we do not elect. And so we have a choice to make. Either we want to continue allowing those people to make decisions about our economy, about our public funding, and all the rest of it, or we wish to empower our Parliament and you, the electorate in Scotland, to make decisions. So it's a historic election, and your vote really does count, and I would appeal to all of you to exercise your vote. I really hope that you give both votes to the SNP. Let's re-elect the SNP in government, Nicola Sturgeon as First Minister, and let's all of us, regardless of our views on the subject, have a say on the future of the governance of this country. I trust the people of Scotland to govern Scotland. Others may choose to let others govern on our behalf. That's not good enough for me in the 21st century. Let's live in a vibrant democracy that will deliver public services like a national care service, and let's get on with it.
Okay, thank you, Angus. And finally, Sarah, please.
Thanks. Well, you see, I think our Parliament is powerful, and I know all the polls say that it's going to be SNP are going to do best, but for me that means that the job of whoever is the opposition is even more important, because this is a tired SNP government, and I desperately want an Asarwar to be the leader of the opposition, to be able to harry the SNP, to push them to do better, so that when we have a national care service, it doesn't rip the final vestiges of care from local government. It funds local government. It stops the 15-minute care visit. It brings 15 quid an hour as the starting point to every care worker, which is what we proposed in the budget just a few weeks ago. So we are absolutely committed to that. I think the SNP isn't doing the day job, and I would want us to be tackling inequalities. And the preventative care is crucial, because people miss out if they don't get a care plan. People miss out if they don't have a council that's ready and funded to be able to stand up for them. And I think coming out the pandemic, making sure that our councils have got funding is absolutely crucial. And it was interesting that when the National Care Service was launched, the local authorities across all the parties are really nervous about it because they can see the centralising tendencies of the SNP. And I do want power in our communities, not just power in the Parliament. And in a way, it's why I'm seeking election again. I'm second on Labour's list. I was out of the Scottish Parliament. I went back to lecturing. I worked for housing associations. We need to make the change in this Parliament. It is one of the most important terms, and it's got to be focused on COVID recovery. And trade unionists in particular are suffering. You see what the British Gas has done, the hire and fire culture. We have got to stand up for people, and Scottish Labour will work with our trade unions, will stand up for them, not just to represent you on a day-to-day basis, but when you've got a problem, come to us and we will help. And every single Labour MSP will make that difference in the next Parliament. Thanks very much.
Thank you very much, Sarah. And thank you, everybody. It's with that final answer that falls on me to thank everybody, all the 5 candidates, for being here tonight and really giving up so much of your time to answer the questions fully as you have tonight. Thanks so much to our audience for staying with us for this 2 hours and for giving up your time and asking your questions. That's been brilliant. I hope you find our meeting informative and interesting. And with that, I'll bring our meeting to a close and wish you all very good luck in the elections and good night.
Thanks, everybody.
Good luck, Sarah.
Thanks. Been great catching up.
Cheers.